We have a list of volumes of the lung that are named and are and that we use to talk about pulmonary pathology. Okay, so that's all on this, and obviously I do want you to know these. Okay, so first off, there in the center, tidal volume. When we talk about tidal volume, that's the size of a normal breath. All right, so it's either inhalation or exhalation. You have to pick one. Okay. But like all of you are breathing a tidal volume in each breath, right? Because you're at rest, and that volume, your lungs are never empty, okay? And typically in our normal resting behavior, we're not breathing, our lungs are not pretty much empty or pretty much full. They're sort of in the middle. So in a normal tidal volume, if this is the biggest your lungs can be, and this is the smallest, your normal tidal volume is about a third of the way up, right? Okay. Now let's talk about this bottom piece, residual volume. We cannot empty our lungs by ourselves. You need surgery for that, and it wouldn't be a surgery you'd want to have, okay? So why? When we take our first breath, when baby's born, lungs are full of fluid, right? Technically, it's not amniotic fluid, it's something called fetal lung fluid. Very creative name, right? Okay, so baby takes their first breath, and the lungs begin to inflate. Then they do something very unusual, which they don't do ever again. They take another breath in without exhaling, right? So first breath, second breath, okay? First breath essentially inflates the lungs to the baseline. Second breath gets you into the working volume of the lungs, okay? So it means that after that point, after that second breath, your lungs are never going to be empty of air ever again. There's always going to be some air in your alveoli. That is the residual volume, okay? And clinically, residual volume does not come up very often because it is very, very difficult to measure. Okay, you literally have to use like a helium diffusion instrument to measure the residual volume. Okay, so that's this bit. I like to think of it as the air that's always in the lungs so that you don't have to inflate them from scratch every time, right? Because of the whole surface tension surfactant issue, lungs that are empty of air are very, very difficult to reinflate. Lungs that have a little bit of air in them are much easier to inflate. So we maintain that with the residual volume. Okay, so tidal volume is a normal breath. Residual volume is always there. Now, let's do some maneuvers. Let's say I have you take the biggest breath in that you possibly could. In other words, make your lungs as big as they can be. So you're going to breathe way in, and you're going to get to the top possible volume of your lungs. So the inspiratory reserve volume is the extra air you inhaled beyond what you normally do. Okay? So that's your IRV. Now, you've had this great big huge breath of air. If I were to ask you, okay, now blow it all out as much as you possibly can. And actually, to get really close to your residual volume, you have to really work at it. Okay, so like when we do these tests with patients, there's a lot of coaching and cheering and shouting and stuff, right? Because we have to really help them. All right, blow out is keep going, keep going, keep going. All right, so you get all the way down here. That is your expiratory reserve volume. The amount you can exhale beyond a normal tidal volume, right? Now, you can put these two things together. You can take the biggest possible breath in and blow it all out. That distance from maximum inhalation to maximum exhalation is vital capacity. All right? Vital capacity in an adult stays relatively constant throughout life. Okay? And the reason for that is it's based on your skeleton. How big can your lungs be? Your bones are ultimately going to determine that. Okay? So your vital capacity, if you work hard enough at it, in other words, you take as big a breath in as you can, blow as much of it out, it'll stay very consistent until your skeleton starts to shrink, right? And then your vital capacity will start to shrink too. All right, so IRV, ERV, tidal volume, vital capacity, inspiratory. Oh, inspiratory capacity is from a normal exhale to a full inhale, and then total lung capacity is largest volume all the way to 0, which of course isn't clinically relevant, right? Because your lungs are never empty. And functional residual capacity is simply from a normal exhalation down to 0. All right, the ones that I most want you to know are these guys. So IRV plus ERV plus tidal volume, so inspiratory reserve plus expiratory reserve plus tidal volume, that's vital capacity, right? And then tidal volume plus inspiratory reserve is inspiratory capacity. That's this one. How much can you breathe in versus how much can you, the biggest breath you can take is vital capacity. Okay, I think I covered all that stuff.